Hello, everyone. Welcome to LUMP webinars featuring basic TCM. Let's start the ball rolling with the first presentation. Let's welcome, straight from Las Piñas, Manila, Ma'am Needs You, certified acupuncturist. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc?
Very clear po.
Okay, thank you. So the topic for today is about blood, day 16. Okay, blood or sweat. Okay. Wait lang po. Let's go to the blood stasis. While Chi stagnation causes distension, blood stasis causes pain. It also occurs without causing pain. It is also the pain from blood stasis. It is usually like a stabbing, fixed and boring. Yan po yung katangian ng blood stasis. Okay. It is associated with purple or dark color. Yan. Example, dark complexion, purple lips, purple nails, bleeding with dark blood and dark clots, dark menstrual blood with dark clots, and the tongue is purple. Okay? Pulse qualities associated with blood stasis are wiry, choppy, or firm. The organ most frequently affected is liver, followed by heart, lungs, stomach, intestine, and the uterus. Okay? Stasis of blood is a dark complexion. There is purple lips. There is pain, which is boring, fixed, and stabbing in character. Abdominal masses that do not move. May purple nails. May bleeding with dark blood and dark clots. May painful periods with dark clots. Purple tongue. Wiry, firm, or choppy pulse. Sa liver na affected ng blood stasis ay purple lips, dark face, painful periods with dark menstrual blood with dark clots, abdominal pain, yung mayroong premenstrual pain, yung tongue ay purple, especially on the sides, at yung pulse ay wiry or firm. Okay? Sa heart naman, kapag may blood stasis, purple yung lips, may stabbing or pricking pain in the chest, may mental restlessness. So purple tongue on the sides towards the front, purple and distended veins under the tongue. So tingnan po nyo yung under the tongue na vein. There is choppy or knotted pulse. Okay? Let's go to the lungs blood stasis. There is feeling of oppression of the chest, coughing of dark blood. Tongue is purple on the sides towards the front part, purple and distended veins under the tongue. Okay? Sa stomach naman, there is epigastric pain, vomiting of dark blood in stools, yung pulse ay purple in the center. Okay? Sa intestines ay mayroong severe abdominal pain and mayroong dark blood sa stools. Okay? Sa uterus, painful periods. There is premenstrual pain. There is dark menstrual blood with dark clots, amenorrhea, fixed abdominal masses. Yung tongue ay purple, yung pulse ay wiry or firm. Okay? In contrast to Chi stagnation, which may not cause serious biomedical diseases, blood stasis is potentially cause of serious diseases. Example, yung cancer, abdominal masses, myoma, endometriosis, heart diseases, or stroke. It does not arise directly as a result of etiological factor. No emotional state leads to blood stasis directly. Some will do so after first causing Chi stagnation. Okay? A summary. Blood stasis derives from other pathological conditions. Yung Chi stagnation, cold, heat, Chi deficiency, blood deficiency, and phlegm. Okay? Blood stasis may cause the following pathological conditions. Yung heat, dryness, blood deficiency, Chi deficiency, and bleeding or yung hemorrhage. Okay? Let's go to clinical notes. General points for blood stasis are bladder 17 and spleen 10. Okay? Ito yung picture about the causes of blood stasis and the consequences of blood stasis. Causes of blood stasis are Qi stagnation, cold, heat, Qi deficiency, blood deficiency, and phlegm. Yung consequences naman ay heat, dryness, blood deficiency, Qi deficiency, and bleeding. Okay? Thank you very much for your attention, everyone.
Thank you very much, Ma'am Nitz. Up next is Ma'am Teresita Sumile from Rizal for discussion of emotional pathogenic factors. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Emotional pathogenic factors. The 7 emotional pathogenic factors are joy, grief, melancholy, worry, fear, shock, and anger. Emotions are necessary and make life interesting and different. If one does not know sadness, how could one value happiness? But when an emotion is felt in the extreme or over a prolonged period, then it can attack the internal organs of the body, causing lasting imbalances. For example, fear and anxiety may be a valid reason for causing enuresis in children. Sadness, when not let out, may contribute to asthma in adults. Okay? Now, just as an imbalance in an organ system may cause a tendency towards feeling certain emotions excessively, emotions felt over a period of time and deeply may cause long-term imbalances in organs. As such, we call them pathogenic factors. Since these emotions have a yin or yang nature, the imbalances they cause can be predicted. So let us take a look at this. Okay? The first emotional pathogenic factor that we will take up this afternoon is joy. In these times, when people pay much money to their psychotherapists for treatment against depression, it does not seem fair to classify the emotion joy as a pathogenic factor, and it is not the intention of the author to do so. Traditional Chinese medicine advocates moderation in everything, which includes the feeling of emotions as well. To feel joy is quite healthy, but to let joy take one over, to get carried away and become very elated and excited, would be to increase heart yang. If this period would last, then it could become a pathogenic factor and consume heart yin, leading to symptoms of quick excitability, restlessness, sleep disturbance, paroxysmal tachycardia, and general hyperactivity of heart. Here we have 4 tower diagrams. The first one, yin and yang are both at a normal state. This shows a balanced heart. Okay. Now the second one, yang increases while yin is still at a normal state. This shows that heart yang increases with getting highly elated. Example, winning a lottery or passing a board exam, especially with a high rating. Naturally, we feel happy or even overjoyed. So our heart yang increases because of this emotion. Now, if our feeling of joy will remain a longer period of time, yin now will decrease while yang is still at an excess state as illustrated in the third tower diagram. This means that prolonged heart yang excess consumes heart yin. Okay? Now, kung pababayaan lang natin ang ating feeling of overjoy, yang now will decrease to its normal state while yin is increasing a little, but still on a deficient state as illustrated in the fourth tower diagram. This means that prolonged heart yang excess causes chronic heart yin deficiency with uncontrolled heart yang. Okay? The feeling of joy is internal. like a glow of contentment and warmth in our thorax. The expression of joy, however, is externalized with laughter and excitement. It is therefore healthy to feel emotions in a moderate fashion, letting them pass through you, but not get very up or down with them. Once the heart yin has been consumed and heart yang is hyperactive and not under control, we need to tonify heart yin. The low connecting point is heart 5, is the most suitable in this case, as it would both tonify yin and sedate yang, and wait for calmness to prevail again. Okay? Now, the author also mentioned the absence of joy here, even though it is not specified as a pathogenic factor. Joy brings situation of yin and joy brings stimulation of yin and yang into our hearts, and we all have a share of joy in our lives. But if a child or an adult has not been blessed enough to feel some happiness in life like me, but had sadness or other emotions only, they could have a yin and yang deficiency in the heart. This is especially so in the case of children who has not been given the joy of love. There is a tendency in them to look for other means of gratification, such as food, alcohol, buying expensive things, and able to love others, but being discontent about everything. Okay? Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now go to yin-yang relationships. And for today, we shall talk about intertransformation. So we have here the first example, high fever. So we all know that high fever is increased yang. And so one of the characteristics of yin-yang relationships is intertransformation. That means the yang can transform to yin. So at the beginning, there is high fever, and initially the yin will contradict. After 2 or 3 days of fever, the yin is consumed. So the patient becomes more dry, thinner, and weaker. And this causes a vicious circle, where the yang increases and the yin decreases gradually. So an extreme point of yang is reached, and at this point, the yang will intertransform into yin. So the situation after transformation, yin and yang are both deficient, but the yin is higher than yang. So the yang has transformed into yin, thus increasing the yin. Second example is manic depression. This time, we have the yin transforming to yang. So intertransformation from yin to yang. So we have here the tower diagram for the liver. And the patient cannot show anger. A patient who cannot show anger will have liver qi deficiency, liver qi or yang deficiency. When angry, the patient suppresses and internalizes anger. So when that happens, the patient becomes depressed, will become passive and rigid. This starts up a vicious cycle where the depression gets worse and worse because the yang will continue to transform into yin. No, the yin will transform into yang until you reach the point of extreme yin. So when the extreme yin point is reached, it will intertransform into yang. So this will bring on the manic phase. So as you can see on the tower diagram, we now have the yin intertransforming into yang. And that is what we call the manic phase. So all the yin has been used and transformed to yang until they both become deficient and there is relative peace. After an interval, the liver yin starts rising again, And then we have the second cycle of depression setting in. Thank you very much for your attention. We will now proceed to the 5 elements. So we will continue discussing diseases of the fire element. This time, we will talk about cold hands and feet, or what we call the Raynauds Syndrome. Treatment, we use local points, the Basi and the Bafo. So the influential point is lung 9, and you can see the energy balancing points on the table. So first, we have cold hands only. So you have heart-yang deficiency of the hands only. That's so we use bladder 15, which is the back shoe for the heart, SI3, and heart 3. Occasionally, we use REN 14, which is the front move of the heart. And we moxa pericardium 8. And if you have coldness of the feet only, that's a kidney yang deficiency. So as you can see, the yang is deficient. Points, bladder 23, bladder 67. Then we needle and moxa kidney 3, kidney 7 occasionally, and kidney 1 moxa. And if we have cold hands, both of hands and feet, that's spleen yang deficiency, coldness of the both hands and feet. So we use bladder 20, and then we needle and moxa spleen 1, stomach 36, liver 13 occasionally, then we moxa pericardium 8 and kidney 1. Many patients with cold hands and feet, such as those with spleen yang deficiency, are also quite thin. So this will give us the impression of being spleen blood and yin deficient as well. So they have to eat more proteins and also cook food, not raw food, and drink warm fluids. Treatment should ideally commence middle to late November. So 2 to 3 sessions weekly, 10 times makes a course. After a month's interval, another course of 10 sessions may be done if necessary. Treatment should be done over 3 years, mostly 1 course per year. The diagnosis and the treatment given are made on the basis that there is enough blood and fluid in the organs, and only the yang needs to be tonified in order to improve circulation. Now let's talk about hyperactivity in children. General tranquilizing points, we have DO 20, pericardium 6, bladder 62, and the extra points, Anmian 1 and 2. Energy balancing points are kidney 7 or 10, spleen 6, lung 7, REN 3, and 14. No caffeinated drinks. So that means no soft drinks. Drink water, blue color in the room, and blue night light. So the blue light. So the imbalance here is similar to that causing postmenopausal symptoms in women. Okay, so first we have, so this is hyperactivity in children. So that means there's too much yang, or there's heart fire due to kidney yin deficiency. So if there is too much, if there is heart fire, there is a disconnect between the heart and the kidneys. So the reason why these children develop hyperactivity is because of kidney yin deficiency. So here we see that the imbalance is similar to that causing postmenopausal symptoms in women. Okay, so treatments should be done daily at the start, total of 10 sessions. After this, we do 1 to 2 sessions a week for 2 weeks, then 1 to 2 sessions a month for 6 months. The problem with these children is they have low kidney yin. and not as many acupuncturists tend to think and treat excessive heart yang. So they should drink water. They should have regular baths that include playing in water and spend some quiet time with the parents. So the kidneys connect us with the past and future. Our past and roots are our kidney yin, and our future is the kidney yang. Our parents are associated with our past and our roots. This link needs to be strengthened, and the child needs this link in order to feel secure and thus feel calm. So quality time with the parents is very, very essential. Thank you very much for your attention. We now proceed to the next topic. Let's welcome once again Ma'am Teresita Sumile, who will discuss the Jing essence. Good afternoon, Ma'am Teresita, once again.
Good afternoon ulit, Doctor and classmates. Now let's talk about essence, day 7 na po tayo. Essence as basis for 3 treasures. Essence and Qi are material foundation of mind or Shen. Essence, Qi, mind, or Jing, Qi, Shen are the fundamental physical and psychical substances of a human being, called 3 treasures. Essence, Qi, mind also represent 3 different states of condensation of Qi. Essence being densest, Qi being more rarefied, and mind being the most subtle and immaterial. According to Chinese medicine, essence and Qi are essential foundation of mind. If essence and Qi are healthy and flourishing, mind will be happy, and this will lead to a healthy and happy life. If essence and Qi are both depleted, then the mind necessarily will suffer. A healthy mind depends on strength of essence, which is stored in the kidneys, and Qi produced by stomach and spleen. Mind is dependent on pre-heaven and post-heaven essence. Triad of essence, Qi, mind is often expressed in Chinese medicine as heaven or mind, person, Qi, earth, essence, corresponding to 3 organs such as heart, stomach, and spleen, kidneys, respectively. So here, mind corresponds to the heart, representing heaven. Qi corresponds to stomach and spleen, representing the person. Essence corresponds to kidneys, representing the earth. Okay? Now, in practice, make a general assessment of relative state of these 3 fundamental substances, as essence gives an indication of inherited constitution. Qi gives indication of state of Qi produced from day to day. Mind gives indication of state of emotional and mental life. State of essence can be State of essence can be deduced from patient's past. History of serious childhood diseases would indicate weak constitution. Pulse with scattered or little quality indicates poor and weakened essence. Tongue shows weak, root has no spirit. So please take note of this. State of mind can be deduced by observing luster of eyes. Eyes with luster with certain undefinable shine and vitality about them show healthy condition of mind. Eyes that look dull, as if they have a curtain of mist in front of them, show that the mind is disturbed. Observe in those who have had serious emotional problems for a long period of time, or have had a serious shock, even if this occurred many years previously. Now let's go to the functions of kidney essence. It determines growth, reproduction, and development. It is the basis of kidney Qi. It produces marrow. It is the basis of constitution, and it is the foundation of the 3 treasures, essence, Qi, and mind. Now let's check our kidney organ meridian system. Signs of kidney energy imbalance are the following: healthy fluid regulation, feeling energetic with lots of vitality, strong bones, healthy libido, and healthy hearing. Now let's go to the signs of kidney energy imbalance. These are the following: frequent urination, prone to fatigue and feelings of weakness, mild joint aches and pains, reduced sexual interest, mild decisions, and we have also other signs are irregular periods, sleeplessness, and night sweats. Okay, kidney essence deficiency in Chinese medicine. Symptoms are slow growth and development in children, no libido and fertility issues, premature hair loss, premature gray hair, bone loss, and memory loss. Okay, yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now go to Zanfu organs. Let's welcome once again, Ma'am Needs You, certified acupuncturist who is now in Las Piñas, Manila.
Good afternoon, everyone. Good afternoon, Doc Hek. So the topic for today is about the liver functions, topic number 2, day 2, okay? So, liver controls the sinews. Yung sinews depends on liver for their nourishment. If liver blood is abundant, it can nourish sinews and enable them to move normally. If liver blood is deficient, blood fails to nourish sinews and numbness or stiffness can result, okay? Sinews becomes dry, less flexible. Injury risk increases also. Sport injuries in athletes can be attributed to this mechanism. Athletes engage in excessive physical activity, which creates heat followed by perspiration. Excessive loss of body fluids due to perspiration can result in blood deficiency, which in turn leads to impaired nourishment of the sinews. Okay? Liver controls the muscle contraction. Liver governs physical movement, which includes sinews, tendons, and muscles. Okay? Liver governs muscle tonus. Insufficient nourishment brings on hypertonicity of muscles. Yun yung tension and stiffness result and can be palpated. Mahahawakan nyo. If tension or stiffness is limited to certain areas, other causes should be considered. Impairment of muscle tonus, yun yung cramps, spasm, tics. When liver wind steers internally, there is tremors, convulsion, and arc back, yung parang naka-arc back rigidity can be observed also. Okay? Liver opens at the eyes. Liver blood is responsible for proper nourishment of our eyes. Liver blood deficiency provokes short-sightedness, night blindness, dry eyes, and blurred vision. Okay, remember. Liver fire, flaming upward, can cause redness and tearing of the eyes. Conjunctivitis is associated with liver fire. All organs have relationships to eyes and contributes to nourishment of the eyes. Okay? Liver manifests in the nails. Nails are surplus of sinews and are associated with liver and nourished by liver blood. If liver blood is sufficient, nails are in good shape, have a rose color, and are elastic. Okay, observe nyo yan. If liver blood is deficient and liver is unable to supply enough blood, it can cause the nails to be pale in color, dry, cracked, or brittle. Okay? Liver houses itinerosol or dahon. Itinerosol stores all prenatal, fetal, and postnatal impressions. Impressions that cannot be mentally digested by the spleen are stored in itinerosol. Itinerosol stores impressions even in unconscious mind states, okay? Our soul stores even those we don't want to perceive. Visual impressions of faces or situations can later create memories. Our soul can be regarded as our emotional memory. Pala yun. Okay? Nightmares can be associated with ethereal soul. Blood houses ethereal soul. Ethereal soul enables us to plan the future based on our experiences. Okay? Profuse dreaming, sleepwalking, or talking, restless spirit are signs of a disturbed ethereal soul. Yan po yun. Okay? Emotion of liver is anger and frustration. Anger is emotion associated with the liver. The sort of anger referred to here can include a sense of frustration. Remember po niyo yan. Pala yan. It is often anger caused by lack of creativity or experience when failing in creative activities. Example, doing artwork or crafts, even doing researches. Okay? All anger caused by a feeling of either not getting what we want or getting what we don't want can be attributed to liver. Tandaan po nyo. Antidote of anger is patience. So, kailangan maging patience para ano. An angry human being will have great difficulty in being patient. Okay? Antidote. Continual anger causes the liver chi to rise and leads to reversal of gallbladder chi and inner wind. Allowing enough time for the things that need to be done relaxes the liver. Okay? Frustration, which lets liver chi stagnate, is also associated with the liver and plays important role in liver disharmonies. Okay? Anger caused by unjust treatment is associated with lungs naman. Okay? Tolerance and flexibility are antidotes and moisten heat of anger. So, yun, kailangan gawin nyo. Claustrophobia is associated with lungs. Okay? Fear of being around people is associated with the liver. Takot. Okay? Thank you for your attention, everyone. I
Thank you
hope you
very much,
learn.
Ma'am Needs. That was very helpful. I'm sure maraming nakakarinig. So the antidote of anger is patience. O, diba? Okay. Let's now proceed to meridian theory. And this time we will talk about this. We will continue with spleen channel of foot tai yin. We are now on part 3. Now, let's talk about areas related to the tie-in spleen. Observation of the spleen channel does not involve any special considerations. Nevertheless, observe changes along the skin surface. So you have to look for areas of redness, papules, or swelling. These are all possible indicators of abnormal spleen function. Pulse palpation of areas related to tie-in spleen. There are no special pulses palpated along the spleen channel, but you should remember that the nature of pulsing along the abdomen on the Ren vessel may reflect the health of the spleen. Palpating the channel, pressing the points, and feeling the body surface. So if you feel a sense of mild pain with pressure at spleen 2 or spleen 3, this indicates spleen deficiency. So if you want to determine or if you want to confirm your diagnosis of spleen deficiency, then try palpating the points spleen 2 and spleen 3. And so there will be mild pain when you do that. So try doing that on yourselves. Spleen 2, spleen 3. So if there is sharp pain at spleen 4, it indicates dampness and heat in the channel, in the spleen channel. Heat accumulation manifests as swelling, pain, and itching in and around the eyes. So if you observe that your eyes begin to itch, or the area around the eyes itch, then you might want to think of a spleen issue. Many types of eye disorders, such as styes, are due to spleen stomach heat toxin. So treatment with spleen 4 bilaterally will be very helpful. So try doing that if you have styes. If the eye swelling is severe, you may consider bleeding the tip of the ear. The area may also be just slightly sore in patterns of spleen deficiency that involve also dampness. So sharp pain with pressure at spleen 5, so sharp pain, may indicate damp heat encumbering the spleen, especially when there is a corresponding mouth ulcers or sores on the lips. No? So this can be treated to help with the pain of an acute outbreak, but long-term treatment must address the underlying spleen deficiency. So milder pain in the area at spleen 5 is also sometimes palpated when there is an imminent outbreak of chronic mouth sores. So chronic mouth sores to spleen 5. Spleen 6 is an area that will show changes in the presence of both excess and deficiency. So conditions of excess will manifest with sharper pain in the area, deficiency, so there is soreness that is relieved with pressure. So spleen deficiency may lead to soft swollen nodule at spleen 6, especially in gynecological conditions. Because the area is associated also, remember spleen 6 is the intersection of the spleen, liver, kidney, yin. It is sometimes difficult to know which channel or condition is involved when a change is palpated. So you should take into account other symptoms. Spleen 6 is associated more with the lower abdomen than with the specific indications involving Qi transformation of the spleen. Therefore, tenderness in the area may reflect a variety of infections or inflammations in the lower burner. Thank you very much for your attention. We next discuss the last topic for today. We are still on breathlessness. Identification of patterns and treatment, part 6. We have a case history. A 42-year-old lady had suffered from breathlessness since age 7. It had gotten worse since moving to an old and dusty house 13 years previously. She found it difficult to breathe in, so this is very kidney. Condition was worse at night and worse following exposure to cold or dust. She also suffered from lower backache and dizziness. She had borne 2 children. Breathlessness had been better during both pregnancies. She felt cold easily and her ankles often swelled up. As a 6-month-old baby, she had contracted whooping cough that lasted for a long time. Pulse deep and weak, especially on both rear positions, the kidneys. Tongue was red, stiff, with a shallow stomach crack with a yellow coating. So here is the tongue of the 49-year-old lady. As you can see, it is red, stiff, with a shallow stomach crack, and the coating is yellow. Diagnosis: breathlessness was due to deficiency of the yang of both lungs and kidneys. Originally, it may have been due to a lung deficiency only, following weakening of the lungs. So the lungs were weakened because of the whooping cough. Later on, the onset of kidney deficiency contributed to the breathlessness. Difficulty in breathing in, feeling cold, backache, swollen ankles, dizziness, weak pulse on rear positions, all indicate kidney yang deficiency. The fact that she got better during the pregnancies also point to a kidney deficiency. If all your issues will feel better than after you give birth, so that is kidney deficiency. However, the tongue pointed to another coexisting condition of heat and phlegm. Deficient lung and kidneys failing to transform fluids led to the formation of phlegm, which further aggravated the restlessness. After a long time, phlegm easily leads to formation of heat. Thus, this shows a clear combination of deficiency of lungs and kidneys and excess. So it's deficiency and excess, the phlegm, heat in the lungs, and of cold from kidney yang deficiency and heat in the lungs. The root is deficiency of the lung and kidney yang, while the phlegm, heat in the lungs is the manifestation. Treatment, because this is an internal condition, we treat both root and manifestation simultaneously. So we tonify the lung and kidney yang, restore the descending of lung qi, and resolving phlegm and clear heat. As the pathogenic factor is internal, we can simultaneously tonify the body's qi, that is, the lung and kidney yang, and expel the pathogenic factor, that is, the phlegm heat. She was treated with acupuncture only using the following points at various times during 12 months of treatment. So it's a long treatment, 1 year. REN 12, REN 9, and stomach 40 to resolve phlegm. Stomach 40 plus PC6 opens the chest and helps breathing. Pericardium 6 to open the chest and alleviate breathlessness. So the directing vessels, so we have the confluent points, lung 7 and kidney 6. Since patient is a female, so we need the lung 7 on the right and kidney 6 on the left. This was used several times to restore the sending of lung qi and stimulate the kidneys grasping of the qi. So the directing vessel or the conception vessel is very important for treatment of chronic breathlessness from lung and kidney deficiency. So you would always see this in the clinic, no? So you need lung 7, kidney 6. Bladder 13, bladder 20, and bladder 23 were used to tonify and warm lungs, spleen, and kidneys with needles and moxa. Lung 5 was used to clear heat and resolve phlegm from the lungs. Kidney 7 and spleen 6 were used to tonify spleen and kidney yang and resolve edema. Needles and moxa were used. These patients' attacks of breathlessness drastically decreased in intensity and frequency over a 12-month period of treatment. Thank you very much for your attention. We hope to see you in our next presentation. Hello, everyone, and good day.